Even before he spoke, Manitobans were dreading Dr. Brent Roussen's words.
We're left with no choice. We have to deal with this virus and the transmission now.
480 new cases, by far the province's biggest one-day spike, forcing Winnipeg into red-level restrictions, the rest of Manitoba into orange.
It's not the time to panic.
It's not the full lockdown of last spring. Schools stay open, at least as much as they already are. Non-essential retail can open to 25% capacity. Bars and restaurants are limited to takeout.
Today is a hard day.
It's happening now because critical care in Winnipeg is reaching its limits. 96% full. Not all COVID cases, but not enough room for cases expected to come.
The demand on our hospital and health system will continue to increase. And if that occurs, we will reach a point where our capacity is not able to stretch enough to meet it.
All in a province that was nearly COVID-free this summer as the government pushed a fast reopening. Now Ami Hassan is shutting down his falafel restaurant again.
On Monday, 80% of the employees won't be here.
Winnipeg's mayor urging everyone to stay home Halloween.
Now's the time for calm. It's a time for compliance.
While the premier is warning of steep fines, there has been little effort at enforcement. A group of doctors wrote a letter calling for a full lockdown.
I think it's probably insufficient. It's risky. I think the likelihood at best is it'll slow down the progress of the epidemic.
A government can't protect you from this virus.
This week, a frustrated Brian Pallister lashed out at people flouting restrictions.
So grow up and stop going out there and giving people COVID.
He didn't speak today, leaving it to non-elected health officials to explain and reassure.
We know exactly what we can and need to do.
Roussen says this will last at least 2 weeks. It's also what he said 2 weeks ago, the last time restrictions were tightened. The numbers haven't dropped yet. Cameron McIntosh, CBC News, Winnipeg.